Why prescription drug prices are so high in 2024. Prescription drug prices have become a great concern within the healthcare industry, particularly for independent pharmacy owners and for Mr. and Mrs. Consumer. Understanding the reasons behind the high cost of prescription drugs is critical for both pharmacy owners and consumers. In this video, we're going to analyze the factors contributing to the high cost of prescription drugs, highlighting the significance within the niche of independent pharmacies and in your home. The origins of high prescription prices. No price controls. One of the primary reasons prescription drug prices are high in the United States is the absence of governmental price controls. Unlike many other countries where government agencies negotiate prices on every drug, drug makers in the USA set wholesale prices based on what competing brand name drugs cost. This lack of price regulation allows drug manufacturers to charge higher product prices. Lengthy patents. Pharmaceutical patents in the United States last longer than in other countries, granting exclusivity to drug manufacturers for 20 years from the date of issuance. This extended exclusively a period prevents competition and allows drug makers to maintain monopoly power, increasing prices. As patents are filed during the drug's testing phase, the expiration date countdown begins much earlier than the drug's actual availability in the marketplace. Limited competition. The lack of competition in the pharmaceutical industry plays a significant role in driving up drug prices. In cases where only one or two companies manufacture a particular drug, the price typically skyrockets. This is particularly true of older name brand drugs that treat rare conditions, as these drugs do not attract multiple manufacturers. Development and production costs. The increasing research and development R&D costs of new drugs contributes to high drug prices. Pharmaceutical companies invest heavily in R&D, with the development process costing and lasting over a decade and over $1 billion in a lot of cases. Additionally, biologics, drugs produced by living cells, incur higher production costs than traditional pill form medications. Cultural importance and the social economic impact. The high cost of prescription drugs has significant cultural importance and social implications. The unaffordability of essential medications puts a financial burden on patients and can lead to compromised healthcare outcomes. Independent pharmacy owners are crucial and critical in migrating and mitigating these issues by providing alternative solutions and exploring cost-saving measures for their customers. Applications and niche presence. The independent pharmacy owner serves as a pivotal player in the pharmaceutical industry, filling the gap left by larger chain pharmacies. By offering personalized care, specialized services, and competitive pricing, independent pharmacy owners address patient-specific needs and pain points within their communities. These pharmacy owners strive to provide affordable prescription drugs and play a pivotal role in promoting accessible health care. Industry experts and thought leaders within the independent pharmacy niche have highlighted the importance of advocating for fair drug pricing and staying informed about legislative changes that may impact pricing regulations. Comparative analysis reveals that in countries where drug prices are negotiated, the same drugs manufactured by the same companies cost significantly less than in the U.S. This underscores the need for reform within the U.S. drug and healthcare system to ensure fair and affordable access to prescription drugs. Trends and future outlook. Current trends suggest a growing focus on transparency and regulation in the pharmaceutical industry. New legislation aims to limit the power of pharmacy benefit managers and increase transparency regarding pricing and operations. Additionally, there's a growing movement towards implementing comprehensive drug pricing reforms, which may lead to more affordable drug prices in the future. And here are some common facts and questions that we get all the time about and related to high drug prescription prices. How can I find cheaper alternatives to these expensive medications? Are there any patient assistance programs available to help with the cost of prescription drugs? Can I purchase a larger quantity of medication to save money? How can I ensure that my insurance covers the medication I need? What should I do if I cannot afford my prescribed medications? And how are drugs priced? How are drugs priced? The insurance company prices the drug. In 95% of all cases, the insurance company dictates what drug price and what copay, and we're going to go over that in further segments on why are drug prices so high in the USA. To address these concerns, pharmacy owners can provide practical solutions such as recommending generic alternatives, assisting patients in navigating patient assistance programs, and exploring options for purchasing medications in bulk. So, independent pharmacy owners have a localized, local area community impact within specific demographics and geographical locations. Understanding the regional relevance of prescription drug prices can help pharmacy owners tailor their services to meet the needs of their communities. Factors such as income levels, insurance coverage, and healthcare infrastructure can all influence the affordability and accessibility of prescription drug prices. And case studies and use studies, real-life case studies and use studies illustrate how important the independent pharmacy owner has successfully addressed the issue of high drug prices. For example, a pharmacy owner can actually share how they work with local healthcare providers and pharmaceutical companies to negotiate lower prices for a specific medication. And promoting sustainability and social responsibility within production, use, and promotion of prescription drugs is critical. And in conclusion, here's what we need. As an independent pharmacy owner, and as they navigate the complex landscape of the pharmaceutical industry, understanding the reasons behind drug and high drug prescription prices is critical and crucial. By providing a user-centric approach, considering expert insights, and analyzing the impacts of price controls, patents, limited competition, pharmacy owners can better serve their customers and patients by advocating for more affordable prescription prices. Healthy living is a long and lifetime journey, so don't be too hard on yourself. Some changes can embrace and lead to big results. So embrace the power of nutrition, nourish your well-being, and find activities that make you feel better and energized. Stay tuned for more informative and inspiring content. If you enjoyed this article and want to learn more about health and wellness, pricing of prescription drugs, and all the other things that go into running a pharmacy or being a patient in a pharmacy, let's navigate the path to a vibrant and balanced life. That's all for tonight. Tune in to tomorrow's session. Remember, please subscribe to our blog post, Tom Jones Pharmacist Live Wellness News, to avoid missing them. And subscribe anywhere you see the link, Tom Jones Pharmacist Live Wellness Blog. Click below to learn more. Cheers to your health, and bye for now.